This is a video of a patient who underwent a open globe injury with a large corneal laceration, as well as loss of crystalline lens. He ultimately underwent a penetrating keratoplasty, and then later our service implanted a CT Lucia lens, which was placed via trocar-assisted modified Umani technique. However, early in the postoperative course, dramatic lens tilt was noted to be present, as seen in the beginning of this video. So the decision was made to return to the OR to attempt to address the lens tilt, either using laser or, if unsuccessful, explanting the lens and attempting scleral-fixation of a new one. So 325 gauge trocars were placed, and an infusion was put into the eye. Iris hooks were used to retract the iris, and paracentesis incisions were made to allow for the endolaser probe to be placed in the anterior chamber. The laser being used here is the Alcon Constellation Machine's PurePoint 532 nanometer laser, and it's being applied directly to each haptic-optic junction with settings of 200 milliwatt power, 200 millisecond duration, and 200 millisecond interval. And it's being applied to the haptic-optic junction until mild graying of that area can be seen. One could also use continuous laser when applying laser to this area. The lens is being stabilized using the light pipe through one of the trocars underneath into a configuration parallel to the iris plane as the laser is being administered. You start with one haptic, and as that side of the lens appears to be straight, then you move to the other, and you can see by the end of the surgery that there's no lens tilt present. Myostat was injected to constrict the iris, the ports were closed, and the case was concluded without requiring a more invasive exchange of the IOL.